Hey guys, just want to let you know I'm streaming now so you can check the feed on YouTube Live.
Okay.
I like it when it's up better because then I only have one chin. I don't like all the chins I have. Oh, wait, we're streaming. We shouldn't talk about that.
And you might want to click remind me later on that Dell update.
Okay.
Awesome.
So here you are. This is you as Mayor Buckley.
Yeah. I'm just going to read this through
It's a
before.
lot. Sorry, it's 5
And then
minutes.
when am I?
Hi, everyone. We're just getting started here, getting everyone signed on.
You're gonna have to sit back and sit up because this is what you look like.
Your audio's coming.
Hi, Director Simmons. Hi, Stephen. Stephen, can you turn your camera the other direction? Mayor Buckley is here. We on Facebook?
I'm good. Now I can hear.
Put yourself
Hey, everybody.
Hello.
Hello. So we only have Dr. Kalyanaraman for a little bit, so we're going to go ahead and let him go first. I will mute Mayor Buckley, Economic Development Manager Rice, and Director Simmons. We'll let him talk. We'll take a few questions, and then we'll hand off to Mayor Buckley. Mayor, would you like to say a few things before we get started?
Well, thank you everybody for tuning in. We want to make sure that we keep our citizens updated. We all know that this is going to be tough, but we are a tough town. We are a military town. We were a town that was the backbone of the formation of this country. We can get through this together. You have the resources in this city, and you will be able to count on us throughout this whole thing until we get to the other side. We have excellent partners in this county. We have an excellent leader of our state. We are one of the best positioned states to deal with this. So thank you all, and let's get on with the broadcast.
Dr. Kalyanaraman, you can go ahead and unmute yourself and get started.
All right, thank you. And thank you for the opportunity. I just wanted to share a little bit about what's happening, and then we can open it up for questions or however we're structuring that. So it's been almost 3 weeks now since we had our first case of COVID in the state of Maryland, and just a little over 2 weeks since we had our first one in Anne Arundel County. We have now 580 cases in the state and 41 in the county, and those numbers are growing by the day, which is what we expect. But just as importantly, we acted quickly as a state, as a county, as a city to really put into place measures that are needed to be able to slow this virus down. And the reason that's important is because there isn't a treatment, there isn't a vaccine for this virus. And so the only way that we're going to be able to manage it is to be able to slow its spread. And why that's important is that because none of us have ever been exposed to this before, if we all get sick at once, we're going to see a lot of people entering the hospital at the same time, and that's going to overwhelm our hospitals. Think about what you saw at the grocery stores when everybody went at once and took everything that they needed. The shelves were bare. You don't want that in a hospital. And so in order to be able to manage that, these social distancing practices that we're talking about, the closures of schools, government, businesses, the prohibitions on public gatherings, the social distancing practices that you're making, that is our only effective prevention. We don't have anything else if we don't do that. And the key here to remember is that as a public health issue, every single one of our actions matters. So when we're not used to thinking about when we go to the store or how we greet our friends and family, but those are exactly the kind of things that we need to be doing. So when we're talking about social distancing, that's making sure that we decrease the circle of people that we interact with to a small and stable number of people, minimum required. Make sure that we keep 6 feet from others, make sure that we wash our hands frequently, hand hygiene, including hand sanitizer when you don't have access to soap and water. wiping down and disinfecting frequently touched objects, avoiding gatherings, avoiding stores when there's a whole rack of people lined up outside. That's not the time to go in, right? That's the time to say, you know what? I need to go when there's when it's much thinner in that store so that I can avoid contact. It's hard to do that. This is challenging. We're not wired for that. When we see our friends and family, we hug them, we shake hands, we sit next to them. And so it takes not just time, but fortitude to make it through that. And that's part of why we're talking about ways to cope with that. How to stay in touch with people, whether it's through phone calls or video chats, how to make sure that you're helping your neighbors, but doing it in a safe way, and people forming neighborhood groups to support their neighbors who can't go outside. There are ways to be active, but the key to remember is that your actions matter, and your actions matter more than anything else that we're doing right now. The second piece is that we're gearing up our health system to be able to manage this. The question I get most often is about testing, so I'm going to answer that now. At the federal level, not enough test kits were approved, and so now that shortage is rippling through every single state and county in the United States. We as a county are in the same boat that other counties in Maryland are in, and I have conversations with my colleagues from around the state every single day. All of us have the limitation on there are not enough tests, and when we do run a test, it takes too long to get the results back. At this point, we're typically running in around the 4 to 7 day mark. That's a long time. We know that. And pretty much every single time we work with a lab company to get stood up, they get overwhelmed within about a few days, and we are back to square one. We're all hoping for better access to lab testing, but I don't have an answer for that in our county that's any different than any other county in this state. So that's the testing piece. On the hospital side, we are working really hard with our partners, and they are working with the state, and I'm part of a work group with the state on hospital surge planning to make sure that we have enough hospital beds for when we see increased levels of hospitalizations beyond what our hospitals can manage at this present time. That planning is underway. It's active. It's happening, and we'll have more details over the coming weeks around that. I want to emphasize one thing, which is that be kind to yourself, be kind to others. This is a stressful time. There are people who are working more hours. There are people who have lost their routines. There are people who have lost their jobs. And all of us are going through this. So if there's one thing that we can do for each other, it's to be kind to each other. I'm going to turn it back to you, and then we'll take the questions as they come.
We already have one question for you, and that is, can we organize volunteers to make gear for doctors like Johns Hopkins is doing?
Yeah, so I know that Arundel Medical Center has it has on their website a way to make masks and donate. What we're recommending around gear is that it be used in low risk community settings. So if you're knocking on a neighbor's door and you wanna help them, that's a really good time to use a homemade mask. If you're volunteering at a meal distribution or food distribution site out in the open, that's a really good time. We're trying to save all of our equipment, so the regulated equipment to use in the healthcare setting, and use the homemade stuff for lower risk community settings.
Terrific, thank you. The next question we have, are safe stations still available during the time of COVID-19?
Safe stations are still available. They're still being used. We are seeing that there's a slight decrease in the number of crisis requests from safe stations, but they seem to be a bit more severe. But the bottom line is they're still there, and they're still there for you.
Terrific. Well, I know you have a limited amount of time, and we have no more questions for you at this time. I'm sure as soon as you hang up, we'll get a few more. But if you'd like to sign off, that's great. If you want to stick around, we're going to go ahead and hand things over to Mayor Buckley.
Thank you, Dr. K. You're doing a great job.
Thank you.
Thank you, Dr. K.
Go ahead, Mayor.
So thank you, everybody. I'd like to first walk through a timeline of what the city has done. On March 6th, we began offering information to the public about prevention strategies. At that point, there were 3 confirmed cases in Montgomery County, all from travel overseas. Our Office of Emergency Management is staffed with the best people to handle this kind of crisis. In 2019, we elevated the office to be its own department and elevated Kevin Simmons to be the director. Kevin has been leading the charge. He and his staff were well prepared to establish within days everything the city needed to continue functioning. Each day, we ran calls to check on all departments. On March 12th and March 13th, we called a special session of the Annapolis City Council and announced the closures of city buildings to the public. We opened the Emergency Operations Center. In Maryland, there were 19 cases. In Arundel County, there was 1 case. By Sunday, March 15th, the city had procured procedures in place for residents to do virtual business with the city, including drop boxes for utility payments, online applications for liquor and inspections. The state of Maryland had 37 cases, and Arundel still had 1. It was during this week that we began to see how generous our city of Annapolis is and how generous its citizens are. We began to see residents stepping up to help out friends and neighbors, as well as complete strangers. We began working with community groups to distribute food to marginalized communities. On March 16th, a Monday, we closed city offices, but opened the non-emergency call center. That number, 410-260-2211, has been staffed with English and Spanish speakers for 24 hours a day since then. We visited the Department of Public Works staff to ensure that they had what they needed days before the governor ordered statewide. The city of Annapolis ceased utility cutoffs so that people can continue to have their water to cook and clean and wash their hands. At that time, Maryland had 57 cases and Arundel announced 3. On March 19th, we announced easing parking restrictions at meters and for curbside carry-out to help businesses that had been ordered to close by the governor. I signed an executive order, number 16, which eased liquor laws to allow carry-out as a way to help local small businesses. In addition, the Office of Economic Development came up with 2 resource guides, one for the workers and one for the businesses. While the city doesn't have the resources to give away money or pay rent, we are able to consolidate information and resources for one-stop shopping. For workers, it was unemployment and emergency health care signups and SNAP benefits and temporary cash benefits. For businesses, it was access to lines of credit, grants for small businesses impacted by the governor's order. We got that message out digitally, and we also visited each of the precincts to deliver the message in curbside chats. On that day, there were 149 cases in Maryland and 10 in Anne Arundel. On March 20th, we partnered to have our food giveaways at Pitt Moyer and prepared food at Stanton Center that was delivered to residents at Woodside Gardens, Robinwood, Bay Ridge Gardens, Bywater and Eastport Terrace, and Harbour House. we announced a blood drive to be held by the Red Cross at Pitmoyer Recreation Centre to address a critical shortage. By the time they opened their doors on Monday, March 23rd, all appointments were booked. On that day, Maryland had 288 cases and Arundel had 24. Yesterday, city offices were closed, but we had volunteers and community partners come out into big numbers to do food pickups at Robinwood, Harbour House, Eastport Terrace. It was rainy, but the volunteers stuck to it. We will continue to work with our partners and nonprofits who will be essential to getting us all through these horrible, difficult times. Today, March 26, we have 41 cases in Anne Arundel County, 58 in the state of Maryland. The governor has ordered closures of all non-essential businesses. That's a tremendous hit to the economy of our city. Each day, the Annapolis Police and Fire Departments are running calls, just like normal, but especially for fire with more volume on medical calls. Our public works employees are delivering water and picking up trash and recycling. We are continuing to make repairs to sewers and water mains. We're delivering essential services. We've worked with the county to bring bathrooms and showers to our homeless community. The city doesn't have the capacity to do this all, and especially not by ourselves. We will continue to count on community partners. In the area of addiction support, we already have established programs including NAM, No Harm, Narcan distribution, and safe stations. These programs continue. We're also working with American Legion on programs to support our veterans. The reality is that we have worked hard over the past 2 years to establish solid working relationships with nonprofit partners, community organizations, and Anne Arundel County. It is because we have these partnerships and these relationships in place that we have been able to engage in all wards of our city as we work our way through this crisis. These relationships will be essential. We can circle back at the end, but I want to ask all of you to remember that Annapolis is a city that is all about love. Annapolis is a city that has faced hardship over more than 3 centuries and found ways to bounce back. I'm not in this alone. I rely on my staff and the amazing employees of the city of Annapolis who have not skipped a beat. I'm thankful for them every single day. We will get to the other side of this. When we do, we will be able to look back and know that we did it because of cooperation, kindness, shared sacrifice, and resilience. A couple of quick items before I hand off to Kevin Simmons, whose leadership I'm so grateful for in these difficult times. First, the Annapolis Film Festival is ongoing, and I know that my wife Jules and I and our sons will be getting a pass and watching a number of films in our home over the weekend. Let's do a virtual watch party with one another. Also, log in to Annapolis Streaming and other online concerts for an opportunity to enjoy a virtual musical diversion. It might be a while before we are back standing shoulder to shoulder, but we can shoulder some support for local musicians and artists. Next, with religious services coming up, we want to be able to go to our usual houses. We won't be able to go to our usual houses of worship during Passover or Easter. Please check in on your elderly neighbors to see if they need technical help to get them logged in to virtual services that they may be offering. And here is Director Kevin Simmons of our Office of Emergency Management, who will talk to you about the steps that his department has been doing so well. Thank you.
Good afternoon, everybody. I'm Kevin Simmons. I'm the Director of the Office of Emergency Management. Glad to be here this afternoon. And I want to talk about some initiatives and some actions that your Office of Emergency Management has been doing during this crisis. Every day since the mayor enacted the local state of emergency, there has been a virtual meeting with all of the department heads and other partners. We meet every day. We haven't missed a day. And during these meetings, we start a review of the 10 COVID-19 objectives. These objectives serve as our guiding principles in our quest to prevent the spread of COVID-19 and flatten the curve to get the city of Annapolis back to normal as soon as we can. I think that's key of flattening that curve and doing everything that we can do. So I'll take a second and go over the incident objectives. One is to provide for the safety and well-being of the Annapolis community during the duration of the COVID-19 event. Two is to provide and maintain the core essential services of the City of Annapolis government. We will maintain essential services for the duration of this incident. Three is collaborate with Arundel County Health Department and the health officer, Dr. Kalyana Raman, to limit the burden and the spread of the disease and minimize social disruption and reduce economic loss. We want to provide the needed stabilization and treatment for those citizens and employees affected by COVID-19. 5, identify and respond to any loss of any basic life necessities caused by COVID-19 to disadvantaged citizens and citizens with functional needs. 6, provide for the timely release of appropriate and accurate information to the public during the duration of the COVID-19 event. 7, provide assistance, direction, and support to City of Annapolis employees. 8, collaborate with federal, state, local, and other partners on pandemic planning and response. 9 is to maintain public order, and 10 is to minimize the impact of business disruption and its effect on our local economy. So our Office of Emergency Management, our Emergency Operations Center is activated at a partial activation at this time, which is our second highest level. The mayor talked a little bit about the call center, and I'll talk a little bit more about the call center. The Annapolis Call Center is activated on a 24-hour basis to receive non-emergency calls from the public. The Annapolis Call Center is staffed by specially trained Annapolis City employees. To date, there have been 258 calls. If you have a question or concern dealing with COVID-19 or other Annapolis City matters, call our call center at 410-260-2211, and you'll hear that number a lot during this cast. In large and escalating incidents, there is a desire from the public to volunteer or donate. If you want to volunteer, we want to hear from you. Emergency Management has a volunteer donation coordinator standing by to connect you with a community project. Some examples would be food assistance or assisting our homeless population. If interested in volunteering, call the Annapolis Call Center at 410-260-2211. The Office of Emergency Management has also implemented a process to capture all staffing and resource costs associated with COVID-19. This will put the City of Annapolis in a good position with the federal government to maximize reimbursement of our costs associated to COVID-19. All City of Annapolis departments have reviewed and has implemented their continuity of government plans called COOP plans. COOP plans are how our departments plan to address how critical operations will continue under a broad range of circumstances to include emergencies, disasters, and crises like COVID-19. It is the city's intent to continue all core city services. City buildings, buses, vehicles are receiving an increased cleaning and disinfecting. The city has installed 80 hand sanitizing dispensers in all city-owned buildings. All our meetings are virtual. In a few cases where they're not, we respect all the standard COVID-19 rules of social distancing and the rule of 10. So what have we done externally in the community? We have a special assistance roster. The Office of Emergency Management has a special assistance roster containing about 130 Annapolis City residents who are elderly, or they have a special circumstance, or they have a functional need. the call center staff contacts them with a "Are you okay?" call. This is an opportunity to address any needs that they may have, such as food assistance, medical appointments, etc. Anyone who has a functional need who would like to be added to our special assistance roster should call 410-260-2211. We also collaborated with the Housing Authority of the City of Annapolis in providing any assistance that their residents may have. OEM has increased our Food Friday program to meet the need. Food Friday program provides fresh produce to families that need this service. This program services about 50 families in Annapolis. Our good partner, the Anne Arundel County Food Bank, provides the food for this program. If you have food assistance needs, call the Office of Emergency Management at 410-260-2211. There was a critical blood shortage in the area. This was caused by the events of COVID-19. OEM joined forces with the American Red Cross to hold a 3-day blood drive. The blood drive took place Monday, Tuesday, and Wednesday of this week. Donors participated by appointment, and we had good success. We had 204 donations over those 3 days, and I thought that was phenomenal. And I applaud the citizens for coming out on that. We've also addressed the hoarding issues at local grocery stores through our social media. OEM makes physical tours of these establishments to keep the citizens informed of their status. We also made physical visits to all of the Annapolis area's assisted living or elder care facilities. OEM met with the management of these facilities to reinforce COVID-19 prevention measures. With the assistance of members of the County Real Estate and Facilities Office and the Department of Social Services, portable bathrooms and shower facilities were made available to our homeless population near the corner of Calvert and Northwest Streets. Street outreach teams have continued their efforts in Annapolis and Anne Arundel County by distributing MREs, meals ready to eat, to our homeless population. As Dr. Kalyana says, it is no vaccine for COVID-19. So our weapons are, again, washing our hands for 20 seconds, avoid touching our eyes, nose, and mouth and face, practice social distancing of 6 feet. If you're sick, stay home. If you're over 60 and you have an underlying medical issue or compromised immune system, limit your non-essential travel. Do not hoard supplies. If you're not quarantined, only buy enough for 2 weeks. Save some other supplies for other Annapolitans' needs. The symptoms of COVID-19 are coughing, fever, and respiratory difficulties. If you have these symptoms, please call your healthcare provider immediately. We're all in this together, Annapolis. Prevent the spread, flatten the curve. Thank you.
Terrific, thank you. Now we'll go ahead on to Stephen Rice, our Economic Development Manager.
Thank you, Mitchell, and thank you, Mr. Mayor. Thank you, Kevin. The mayor did an excellent job of recapping some of the things that we've done from an economic development standpoint to spread the message with respect to what's happening and what the city is doing. I would like to reiterate, however, that the Office of Economic Development has launched 4 websites. These websites outline business resources, workforce resources, small business relief information, and also which restaurants in the city are actually open for curbside delivery and pickup. Recently, as many of you I'm sure have seen, the governor has rolled out $175 million in assistance programs to support businesses that are dealing with COVID-19 and the economic impacts. And specifically for the Office of Economic Development, we have this information on our small business relief page. And those programs, just very briefly, within the Maryland Department of Commerce, there is the Maryland Small Business COVID-19 Emergency Relief Loan Fund. There's also the Maryland Small Business COVID-19 Emergency Relief Grant Fund. There is the Maryland COVID-19 Emergency Relief Manufacturing Fund, and with the Maryland Department of Labor, there's the COVID-19 Layoff Aversion Fund. All of this information, links to the funds, applications, frequently asked questions, all that information can be accessed through the Office of Economic Development page. And also, I know that there are a lot of displaced workers who are looking for employment. Many have no doubt filed for unemployment insurance, but Anne Arundel Workforce Development has a new site called Featured Jobs. And this site essentially provides information on hiring positions and hiring opportunities for people who are looking for work. So if you go to the Anne Arundel Workforce Development Corporation page, look for the Featured Jobs link, you can have access to that information. There has been some outreach prior to the call, and there were questions surrounding resources for people who have 1099s, essentially they're contract employees or who work on commission, like real estate brokers. And I did reach out to the Maryland Department of Labor looking for resources for folks who fall into those categories. And what I've been told is that the state's grant program, again, the Maryland Emergency Relief Grant Fund is an option. The Small Business Administration microloans program, which is different from the Emergency COVID Relief Fund. The SBA microloans program, which provides loans up to $25,000, is an option that people should look at. And then also there's the Kiva loan program, and that's K-I-V-A. So I also know that at least some of the language in the congressional bill that has not yet become law, some of that language includes, as I recall, some federal assistance and relief for contract workers and those who make their living off of commission. So hopefully once all the different negotiations are complete and the bill becomes a law, there will be some federal assistance that will be available as well. That's all that I have on my end. Thank you very much.
Terrific. Thank you, Stephen. We do have some questions that have come up. So let me try and get back to our full screen. The first one is probably for Kevin Simmons. Are there confirmed cases in Annapolis City?
So we're working on this issue because what I think is happening is they're grouping all the cases in Anne Arundel County together. So they're not separating them out in Annapolis City. I know of one case confirmed in Annapolis City that I know of, but we're working with the health department to actually separate them out so we actually know what's happening in Annapolis as opposed to Anne Arundel County as a whole.
Thank you. The next one is probably for Stephen Rice. What steps can the city take to help out service industry workers? Some of that you've already answered.
Okay, yes. Actually, Anne Arundel Workforce Development Corporation is your best resource at this point in time. And we also have access to resources on our economic development page.
Terrific. The next one is from Melissa Curry. City offices are closed, but staff continues to work. Can you speak to what the city is doing to protect the health and safety of city workers? That's probably more for Mayor Buckley or possibly Director Simmons.
I think Mayor Buckley is muted.
There you go. You're unmuted.
Thank you for that question. We obviously moved immediately to as much teleworking as possible, but obviously some services can't be done remotely. So any people who come into the office, when they have to come in, we obviously practice social distancing, we sterilization, all the sorts of things practices that you would practice when you are outside. We understand that our public works, our police, our first responders, our fire, they're our heroes. They're the guys that are really keeping the wheels turning in the city. And I'm just grateful for them and for what they're doing, because they are out there and they are doing an excellent job. And what we can do for them is stay home as much as possible and don't endanger them.
Terrific. The next question comes from Diane Love. Can we get a list of non-dining establishments that are doing carry-out with the interactive map similar to the one that we've done for other restaurants? Stephen?
I'm sorry, non-dining establishments that are doing carry-out?
Yep.
I'm not familiar with that. I mean, if any as I understand it, restaurants are essential services, and they are the ones that are permitted to provide carry-out services. So I don't believe that that's something that is one allowable, or two is something that we can do.
Okay. If there are places that are
Mitchell.
Yeah.
Maybe we can connect Diane and Stephen together, and they can work that out.
Yeah,
Sure,
I think that we've been
that I'm missing. Absolutely, she could reach out to me directly.
And I know that that list is ever evolving, because there are some businesses that were initially on the list that have stopped doing curbside or carry out. We're removing those from the list. So each day we do a update, and then we update the interactive map, I think at 8 o'clock in the morning or something. So there's constantly updating. We can add other businesses. Next question from Jessica Packler. What are we doing to reach out to non-English speaking residents?
Mitchell, that's a good question for you.
It is a good question for me. And I do have some resources that we've put up online, which I'm going to navigate to. Slide 6. Thank you. So if you click on the home page, let me move this out of the way. If you click on the home page here, we've sort of rearranged all of our COVID-19 resources into one area. If you go to the next page, which you click through to, there is a page of resources there. And I just put together some of the resources that we have about hand washing, social distancing, the symptoms of COVID-19. We have all of these available for printout. If you know places where these can be printed out and handed out, feel free to download them. They're right on the right side of that page. So please have at it. And if you know of other ways that we can do outreach other than the website and Facebook and Twitter and Instagram, we'd love to hear about it.
I have something to add, Mitchell.
Mm-hmm.
Hi, Jess. Hope you're doing well. A lot of our Food Friday families are Latinos, and it's my sense that it's a lot more Latino families that are out there that can actually use that Food Friday service. So if you could help us get the word out there, we would love to make sure that we can serve every family that needs that type of service, fresh produce on every Friday. So if you can help us with that, please reach out to the office.
Terrific.
I can weigh in a little bit on that too. Brian Callahan in the mayor's office is going to be reaching out to our partners in the hospitality industry to come up with a strategy or a plan, because we understand these families are some of our most vulnerable with very limited options. And so as that develops, we will make that public.
Terrific. Our next question is from YouTube. What can you tell us to reassure us that it's safe for us to engage in curbside pickup from restaurants Can COVID-19 virus be transmitted in this way?
I'll take a shot at that one. Again, you use all the COVID-19 measures when you pull up to the curbside. Make sure you're exercising your 6 feet rule. What I'm understanding from what I'm reading, that the virus can live on a hard space for a little while. So once you get your food home, use some kind of gloves or something and transfer the food to a plate or another container and throw that container immediately away. And I think that would be some of the best ways that you can prevent the transmission on a hard surface, like a container that you will receive from a restaurant, if in fact it was contaminated.
Terrific. Richard Edwards wants to know if we can lower taxes, that people need immediate tax relief.
So, we are hoping that our federal partners bring some resources to the city. The city's budget, nearly 70% of the city's budget is for first responders. So first responders and public works and associated services with those. So that makes up a big part of our budget, and they are the people that are out there protecting us right now and keeping the city running. But I would love to have that option, and that is really going to be down to what our federal partners do for us.
Also, I believe the governor put off state income taxes until July.
And the city also, we stopped any kind of shut-offs, any kind of fees, any kind of things that you might have to pay in this time, because we understand, we are your partner, we are here to help. So it won't be any pressure that you're getting from the city in these tough times. If you are, please reach out to us, because we have to work on this together. We can't be part of the problem. We have to be part of the solution.
We have another question about state exercises. Did the state participate in a tabletop exercise run by the CDC during the summer? The topic was viral pandemic. More of a state question than city, but that's from Rita Porsman.
I can't tell you what the state has done, but I can tell you what the city of Annapolis has done. And it started back, I think, in 2016. We practiced a pandemic full-scale exercise by having a drive-through flu clinic. And that allowed us to exercise our pandemic capabilities. Just imagine if they find a vaccine for COVID-19 and we had to do a mass inoculation. We've already practiced how to set that up. And we did a drive-through flu clinic at the Navy Stadium parking lot on 2 occasions. About a month ago, all the department heads in the city of Annapolis joined all the department heads in Arundel County for a tabletop exercise involving COVID-19. So I have full confidence that moving forward, our department heads and the city of Annapolis, just like Anne Arundel County and their department heads, will certainly meet this thing head on based on our training.
Excellent. We have about 15 more minutes, but I will continue with the questions until we run out of time. Another one from Jessica Packler. If we can't this is possibly a question for Dr. Kalyanaraman. We can send that to him offline and get a response for her, but we'll go ahead and ask it here. If we can't flatten the curve, if contagious people are spreading diseases around the city, since there is minimal testing, what are sick people supposed to do? They're being sent home without being tested because there are only enough tests for the sickest people and are told different things by different testing sites and doctors. What's the rule? If you're sick, how long should you self-quarantine? If you think you have it or have been told to assume you're positive without testing, what should you do?
That is certainly a question for Dr. Kalyanaraman. And Jess, it's important that we all practice social distancing, washing of the hands, not touching the face. If you're over 60 and you have an underlying health issue, that you suspend your non-essential travel. Because people ask me all the time, How long do you think it'll last? Do you think it'll last till it gets warm and then it'll go away like the flu? Or do you think it'll last to November? Nobody knows. But the only thing I do know is it all depends on flattening the curve and not overwhelming our health system. And if we don't flatten the curve and we have a steep bell curve, not only does that mean that we're going to have a lot of sick folks, that means folks are going to die. So flatten the curve.
And I would just add to that, the city, the county, and the state, we're ready when we get the test kits. We are ready to move into rapid testing and mass testing, and we know that mass testing has to come because we need to know who's clear of this so that we can get back to normalcy, so we can trust that our teachers are safe, that our doctors, our nurses, our first responders, we have to know that they've been tested. So, that has to be the plan. It is the plan that has worked in other parts of the world. So the sooner we get that done, the better off we'll all be and the faster we will move out of this.
Great. Our next question is from Fernanda Elliott. This is probably for Stephen Rice. And it's unclear which loans she's talking about, but when will we hear about our loans being accepted or not?
That's a good question. It really depends on the loan program. There have been some minimal guidance that's come out regarding application times, response times, and notification times, but it really just depends. I would check with the specific agency through which you're applying for the loan, for those specific.
And I would guess that there are a lot of applications and a lot of, I know for unemployment today, the county, which normally has about 100 or 200 applications for unemployment, last week had 4,517 applications for unemployment. So there are a lot of people asking for help, and the system is going to be stressed. John Frenay has a question for Stephen. The grant program for the state exempts anyone that does not have a W-2 employee. There are a ton of sole proprietors and LLCs that do not have employees and are in need. It's not really a question, but do you have a comment on that?
I'm hoping that there's some federal relief to those workers, and I'm not sure if some of the loan programs and the grants that I spoke to earlier might apply. If they apply for people who have are on commission or who are 1099, they possibly could apply for those who are have LLCs. I would say that those same programs and I'll read them off again, the state's, the Maryland Emergency Relief Grant Fund, the SBA microloan program, and the Kiva loan program are probably your best bets. I believe that people who fit that specific situation are probably eligible to apply for those programs.
Terrific. Next one is from Marty Etzel. Stephen and Mr. Mayor and the rest of the city, I'm speaking to you on behalf of 5 bed and breakfasts. We account for over $200,000 in real estate and hotel tax paid to the city. We need help from the city as we anticipate the other side. We suffer from a long list of regulatory burdens placed on us that aren't imposed on short-term rentals, hotels, and inns. We need to start discussions now with you and planning and zoning. We can make a significant increase to city revenues once we are past this challenge.
I can say that I think that the city will be your partner in moving forward. We are going to have to do as many things as possible to help out the business community. I mean, we have a health crisis, but the economic crisis is like something the world has never seen. But remember, it's the whole world. So we have to solve it together. There's no choice. We will fix it and we'll get to the other side. And I would say anything that stimulates the economy, will get a favorable rating from us, because the sooner we can get people back to work, the sooner we can get back to normal. So I will reach out.
Another question for Stephen. Can self-employed people apply for unemployment?
I don't believe so, but I will. I'll let the folks at the state make that determination. My understanding is that you have to be laid off or fired to be eligible. But I would reach out to the Department of Labor and let them make a determination.
And so that's a really good question. We have a lot of people in that category in the city. We will do the research and we'll get that information up on the website as soon as possible.
Okay. The next one is for Director Simmons. Are we testing the city's first responders?
We've had cases where we were able to get some testing for the first responders, not on the scale that I would like. And I'm anxiously waiting for the feds to release some testing apparatus so we can do that. So we do have the ability with the health department to get testing, but not on the scale that I like. So as things occur and one is exposed, we're able to get some testing.
Great. Alderwoman Tierney would like to know, will there be another blood drive?
You know, I offered it up to them. Originally, we didn't know how things would go because we needed to use that auxiliary gym for other purposes for COVID-19. And we allowed them to do Monday, Tuesday, and Wednesday, and it went so well. And we wanted to extend it to Thursday and Friday, but they had another engagement somewhere else. But I talked to Mr. Bruce of the Red Cross, and there may be opportunities maybe next week or the week after where they can come back and we can have a blood drive. And again, you just can't walk off the street. We're trying to maintain social distancing and all of that. So it has to be done by appointment.
I understand too, Arundel Medical Center is accepting appointments at their location over by the hospital. But you have to call, same thing, you have to call for an appointment.
And can I just say a big thank you to the citizens of Annapolis. This is a blood drive that's never been done in this format before. You could only come if you made a reservation, but the first day filled up, then the second day filled up, then the third day filled up. That just speaks to the character of the people that live in this city and their generosity. So I want to say a big thank you to everybody that gave blood. I'll be there for the next one. I'm just trying to clear out from last time I gave. So.
This has been an ongoing question I know that we've had a couple of times. I've seen on Facebook. We have a couple of warm, sunny days coming up in the weather forecast. How will potential crowds of people congregating downtown be dealt with?
I mean, we're dealing with that in all the parks around the city. I mean, we just have to keep our distance when we're around other people, but staying healthy and strong and getting vitamin D, that is, and the psychology of getting outside and getting away from the news and getting away from the TV screen, that is just as important as all the other practices. And so, you know, I am encouraging that with the distances. We have fabulous parks in the city and the county. Just keep your distance, go for a paddle, that keeps you distant from people. Go for a bike ride, that keeps you distant from people. So there are plenty of things that we can do, but we have to keep doing them because, you know, you want to be in your best physical shape. We know we're at the start of this thing, so let's all get strong together.
Next question for Stephen. Landlord and creditors coming after you for payment. What are we telling small businesses to do in those circumstances?
Well, what we've been telling landlords and financial institutions is to be as flexible as possible with respect to lease obligations for business tenants, and also when it comes to refinancing, loan forgiveness, and renegotiating loan terms for commercial businesses. If there's any help that we can do, we're here to help. We're here to have conversations. If someone wants to reach out to us confidentially, we will try to, in addition to using the bully pulpit, use a soft touch, but we're here to help. I'm not exactly sure that there is a an easy solution to any of this, but to the extent possible, we have been asking landlords and financial institutions to be flexible. And I know the mayor has spoken about this previously. There's a Bank of America program, and Bank of America is your lender. They have been moving 3 months of loan payments to the end of loan terms for a lot of their customers. We're hoping that that sort of a policy is replicated throughout the financial industry so that folks get some sort of relief. But reach out to us, and we will have confidential conversations and see what we can do.
And I would say, you know, everybody needs that 90-day relief. So we hope all the other lending institutes will fall in line, and landlords. I mean, I would be shocked if people were heavy-handed during this crisis. What counts the most is survival. And so landlords should be thinking the same way. You know, if you feel people are being heavy-handed, please call helpline, and maybe we might have some leverage, or at least we can shame them.
Okay, the next two questions, I'm going to put them together because we only have about 4 minutes left, are for Director Simmons. The first one, are we getting updates about hospital beds, the number of beds, the number of open beds, open ICU beds? And the second one, do we have a crowdsourced list of people or organizations that are volunteering to shop for people, to bring food, to help our most vulnerable residents?
So we do keep contacting with Arundel County Medical Center, and I don't have the stats on how many open beds they have, cardiac beds, et cetera. But I know my last conversation with them, they were at 97% capacity. And that was a couple of weeks ago. So I'm imagining that they're at full capacity now, but I can't answer that question accurately at this point. As far as volunteering, we do have a person in charge of volunteering and donations. And I know when you have a time like this, and we get many, many inquiries about people wanting to volunteer, and we want them to volunteer. We want all the help that we can. And again, 410-260-2211. If you think you want to volunteer, if you have any non-monetary donations, especially foodstuffs, we'd like to hear from you. We want you helping us and helping the community.
Couple other questions about the number of cases in Anne Arundel, so I'm going to put that up on the screen again.
Can you talk about that diagram, please, Mitchell?
Sure. I basically use the coronavirus.maryland.gov website each day, starting back on March 1st, when those first 3 cases came up in Montgomery County. I started just making a data set just to track it and see where we were. So every day I go in, I update it, and I create this little chart. I actually have it for all counties, and Baltimore City. So just helps me stay in line with where we are going and how the curve is going, and if the curve is bending. And it doesn't really look that way right now. So I have another.
The blue line is the state, right?
Yeah, the blue line is the state, and the red line is Anne Arundel County. Anybody that wants that can email me at mwstevenson, that's STEPHENSON at Annapolis.gov. Be happy to share that with you. But it's all information that you can get on the state website, which is coronavirus.maryland.gov. The reason I started to create this was that each day as they bring on new numbers, they wipe the old numbers out. So I couldn't really see how the data set was growing, specifically for Anne Arundel County. Questions about Commissioning Week and the Spring Boat Show. Commissioning Week, I think, was already canceled by the Naval Academy. And the Spring Boat Show is on hold for now. That's the weekend of April 24th. So we're still a month out from that, but it seems like that's probably not going to happen. U.S. Naval Academy has not made a decision on Commissioning Week yet. Okay, and the last one again is how are we dealing with crowds? And the inbound inquiries that we've had on Facebook and Twitter and in other places, talking about crowds, what we've been telling people is to, if there are crowds gathering, to call the police, that is one of their duties, is to go out and tell those folks to disperse and keep good social distance and all of that. It would be really great if we didn't have to have our public safety folks out doing that kind of enforcement and that individuals could be responsible. But when they're not, we've got the folks who can do that. Any further comments on that?
I think, the police are being very kind, and the way we want people to be in the city, and just saying, hey guys, is it okay if we just spread out a little bit? I think we're gonna obviously have to think like that. We don't want to be the corona police. No, I mean the firefighters, the police officers have a tough job already. So I think, as a community, we have to police this as well. And I think that is happening. People are reaching out to us, and an inspector here and there will say a word or two. But we have to be mindful of this because we all want to get better, and so that's going to take a team effort.
Terrific. Well, it's just 5:02, so we went 2 minutes over, but I want to thank everyone for tuning in. We had a nice, healthy crowd join us for this first virtual town hall from the city of Annapolis. If you'd all like to say goodbye, have a nice Thursday night, everyone.
Thank you, everyone, for tuning in. Thank you.
Thanks, everybody.
Thank you.
End meeting.